Hello, it's Dr. Troy here, the Vancouver chiropractor. I want to talk about shoulder discomfort. Very common complaint now with people's sedentary lifestyles. A lot of sitting, a lot of driving, a lot of computer work, a lot of TV work. Then you got the texting of the neck. So if you look at the biomechanics of the cervical spine, the spine is like the frame. And so your shoulders that come off in this region and your legs that come off down in your low back, those are like the front tires, if you will, of the shoulder region. And then the rear tires would be your low back. So if the frame is in alignment, then the tires are going to roll properly, they're going to turn properly. So with our sedentary lifestyle and the things that we do, the traumas that we have and the things that we ignore, a lot of times what's going to happen is we're going to develop this forward head shift. So the head's going to go forward, and for every inch you go forward, you're going to put an extra 20 pounds of pressure on the spinal cord, the brainstem, and the nerve roots. So those nerve roots send messages to not only your organs, but the muscles that control your shoulder girdle and neck. So imagine this, if we tip my head up and externally rotate, that would be a great stretch to do. But here's what happens. We start going forward. Your shoulders are going to naturally want to internally rotate. It's going to contract the posterior muscles of the back of the shoulder. And so now you get shoulder dysfunction. So how do we clear that? Well, what are some of the signs too? But first, you can get shoulder pain where you can't lift your shoulder up, also known as frozen shoulder. You might have limited ranges of motion. I can't turn this, or it hurts when I lift this certain way. That's actually what happened to me when I was in high school. I couldn't even lift the milk out of the fridge because my shoulder hurt so bad. And a chiropractor actually corrected the problem. And it was mostly coming from my spine. So I had loss of joint integrity and movement in my spine, and it was affecting the functionality of my shoulder. So that's one of the things I'm very, very familiar with, is how to help shoulders get better. So one of the things that we do is we do an examination to see where's the shoulder problem coming from. Is it coming from the joints in the neck, or could it be the joint, the glenohumeral joint, where it has restricted movement? Especially if you have trauma in the past, you can create scar tissue. So we evaluate you. We x-ray to see if there's any misalignment. Also, there could be complicating factors such as degenerative disc disease, arthritis. You could have disc issues. So these are all things that could predispose you to chronic long-term problems, and addressing those before they turn into a big mess is always recommended. But even if you're in a big mess, there's a lot of help that we can provide if, in fact, the joints are out of alignment. That's something we specialize in, getting people better, getting them out of pain as quick as we can. If you're interested, free consultation for watching this video. Dr. Troy, 360-260-6903 is my number. Come see us at Zenaptic Chiropractic. We're happy to serve you.